The Alleghany Journal was fortunate to speak with Major Terry Cronk, who's the director of the Regional Jail here in Covington. Thanks very much for seeing us, Director Cronk.
Thank you, Mr. Clark.
It's budget time, and everybody in Alleghany County and Covington, they're facing various costs from trash increases to tax increases. You've been to the Board of Supervisors in a number of cases and has indicated that jail costs are very tough to estimate and they're increasing. Can you talk about that a little bit and explain to the public on why that is so difficult to handle?
Well, yes, sir. There's no way to ever predict the number of arrests on any given day, week, or month. We can comfortably bed down roughly 100 people here at the Regional Jail. This morning when I come in, I have 102. I'm holding 24, I think, off-site this morning over at the Western Regional Jail in Dixie Caverns. That's at the cost of $30 a day per inmate. Got a few figures in 2017. In 2017, I had 3,853 inmate days in the Western Regional Jail to the tune of $115,000. and 960 inmate days at the Roanoke City Jail to the tune of $28,000 for a total of $144,390 that we paid out last year just to house prisoners off-site.
And you're responsible for all the costs with respect to each inmate, from pregnancy costs to drugs?
Yes, sir. The drug and medical problems have spiraled. Just because I've got someone in jail doesn't mean I can ignore their medical problems. Pregnant females cost a lot. We are pursuing a program right now where we're going to try and get Medicaid to reimburse us for some of those costs. I've got my 2 secretaries going in 2 weeks down to the Riverside Regional Jail to take training on recovering costs through Medicaid, but nevertheless the medical costs spiral completely out of control. I recently had one inmate in here that was costing us in excess of $5,000 a month just to provide his medication for him. We do try to recover some of the costs through a copay through the inmates, but it's negligible at best. You know, most of the folks in here, they're not wealthy people or have resources. We do recover what we can. We've even implemented a program whereby we recover costs through the Treasurer's office each year at tax time. But again, it's marginal when you compare that to the overall cost of what it takes to treat the inmates.
There's no way for you to be able to predict the number of inmates you'll have at any one given time. For example, if there's a drug raid or a spike in crime, that's just something that happens and the judge assigns somebody to jail based on what, a random set of circumstances.
Yes, sir. There is no way to predict it. The circuit court does grand jury indictments 4 times a year. There's been days where we've processed as many as 55 and 60 people through this jail at one time. And there's no way to know which ones are going to get bonded out and which ones are going to stay.
Could you briefly explain how you interact with the state? In other words, if a man gets or a woman gets a certain amount of time in prison, how long do they stay here before the state takes possession of them?
The state has a policy now that they can leave short-term people who have been committed to the Department of Corrections, but anything under 3 years they can, and sometimes do, require the local jails to leave them in the jail, which simply becomes an unfunded mandate from the state to hold prisoners that they should be responsible for. And it's kind of a double-edged sword. Yes, they're committed to the Department of Corrections, but while they're here, they're still considered local jail inmates. So I have to provide all the services.
All the services, totally. Food,
everything.
Drugs, everything. And so the jail receives a certain amount of funding from the DOJ, or the Department of Criminal Justice. Does that meet your actual cost to house them?
No, sir, it does not. We receive a per diem from the state. I believe it's broken down into 2 different categories, but I think the most we get is $12 a day for some inmates, and it's less for others depending on the level of their crime. And the last figures I had for the operation of this jail was, when you calculate everything into the equation, the total amount of my yearly budget, the jail, it works out to like $86 a day per inmate is what it costs to have an inmate in this jail.
I'm sure you have an opinion of this, but with respect to the funding for the regional jail, I believe it's accurate to say that Covington is responsible for approximately 26% of the cost and Alleghany County takes the rest?
Yes, sir. It's my understanding. I've got a copy of a joint services agreement that was signed, I believe, back in 1953, whereby Covington has to pay a certain percentage of the cost. I read in the paper, the local paper, just the other day that they were going to cut their funding by $21,000 this year for the jail. There's no way to calculate exactly each year how much their percentage is going to be, because it's almost impossible for me to predict what the actual cost of operation of this facility is from one year to the next. So if they cut that amount of funding, I'm not sure where those funds are going to be recovered from.
And your services are mandated?
Yes, sir. This is not discretionary spending. It's not like I can just say, I'm not going to do this or do that. Everyone here is placed here by court order, and I can't violate court orders. I simply have to lock up people when I get an order from the court. So the jail being not nearly big enough now, decisions that were made roughly 25 years ago are now coming home to roost, because this jail's not big enough. We're spending upwards of $200,000 a year now to house prisoners off-site, and I only see that getting worse. The population trend is up, and
by the population, the jail population.
My average daily population in 2013 was 83, and my average daily population last year, if you factored in all the ones who were held off-site, would have been 114.
Of those challenges, financial challenges that you have, what do you believe are the most significant, or the ones that concern you the most for the next fiscal year, which begins on July 1st, I believe?
The medical issues are huge. The county last year provided the funds to hire an additional nurse, so I have 2 full-time nurses here. To put that in perspective, the last time I checked, the local hospital had and so I have a nurse here during the day and one here during the evening. And inmates are a very at-risk population. A large percentage of them have substance abuse problems and mental health problems. So there's just no way to predict medical costs. I have to deal with pregnant females. I have to deal with the opioid addiction problem. It's huge. The drug problem in our area is swelling my jail to capacity.
And the jail was built for how many inmates?
Initially, this jail was built to house 56 inmates. And I can barely remember the last time I had less than 100.
And you see the population, the jail population growing. Is that based just on a recent trend, or are those predictions that are coming from you, or are you seeing those as a statewide trend?
Well, I don't know about the state, but my figures can back up what I'm saying. It's grown steadily each year. I've been here since 1984, and I haven't seen any reduction over any one-year period at all. It just steadily keeps climbing.
Was the figure of a cut that you heard from the city of Covington, was that based over with respect to what they gave you last year?
I have no idea where they arrived at that figure, Mr. Clark.
Okay.
I don't know. To me, it's arbitrary. No one's ever come and asked me, could I cut $21,000 from my budget? So
the cost concerns that you have, it's not any one particular area. It's for each inmate. Costs in a variety of additional services must be funded for each additional inmate.
I mean, the thing a lot of people don't realize is I run a health clinic, a mental health facility, a full-service restaurant, a laundry, a library, a recreation hall. We have a work crew program, commissary services. We supplement the court services. We also have been supplementing the school resource officer with my staff. So I'm constantly short-staffed, and every day it's a budget challenge here.
And you had indicated in the past, Major Cronk, that personnel, experienced personnel, is not easy to come by in a jail facility. Could you talk about that a little bit?
Yes, sir. starting pay for a deputy is roughly $32,000 and change. I have to compete with our industrial neighbor across the river here, West Rock, and other places. It requires a lot of commitment to be a deputy, especially to work in the jail. They have to go to school. It takes about 14 weeks of basic academy to become a deputy. The cost there, it costs roughly $1,500 to outfit a new deputy in all the uniforms and accoutrements that he has to have, and that's not counting the sidearm. So yes, you can go almost anywhere and make more money than here.
And Major Cronk, finally, the budget process is fairly lengthy. It starts maybe as early as November or December, and I believe that the county asked many of you to come to budget meetings and have discussions about future costs so they can plan their budget. Your budget will be, the prediction is for it to climb this next year. And do you see anything that can mitigate those costs?
Not right offhand. I mean, I can tweak it here and tweak it there, which I have done over the years. I've cut a lot of costs in a lot of areas, and believe me when I tell you and the public, I'm a budget hawk. I don't believe in taking taxpayer money lightly, but I'm tasked with the operation of the regional jail for my sheriff, and I simply have to provide for the inmates. And you know, to do that protects the county. It protects the county from litigation, and it provides the services that are ordered by the court. So, you know, I hate to say it, but the price that it is, there's many prices I simply can't control. I've got to provide the services as mandated by the Department of Corrections to the people that are placed here by order of the court.
Thanks very much for joining us.
Mr. Clark.